So as we move into this short period of relaxed breathing, I'm going to invite you to take your left hand, let it rest on your belly, thumb maybe around your belly button, hand sort of on the lower belly, and bring your right hand onto the mid part of your chest, right in the middle of the sternum. And if it's comfortable for you, I just invite you to close your eyes. If not, just a soft gaze off the top of the nose onto the floor. And for a moment, just inviting your attention to come to the experience of the breath coming in and out of the body. To just, in other words, just recognizing that breathing is happening. That there's no moment-by-moment control of this. It's just happening by itself. And your hands are here as a biofeedback tool. I'm going to invite you to begin to explore, as you're observing your breath, how you feel it and where you feel it. And your hands are helping you do that. Some of us might discover, as we bring attention to the breath and the hands and the body, that we notice most of our breath in the area of the chest and under that right hand on the chest. Some of us might notice that we're noticing most of the expression of breath in the belly under the left hand. Some of us might notice a mix of that. Some of us might notice that our breath is so shallow that there's hardly any experience of it at all. So it doesn't really matter as we begin the practice what it is we notice. What matters is that we're just giving our attention to this experience of breathing. And then after we've connected with this experience of breathing a little bit, we can become a little bit more intentional with our breath. In other words, we can begin to work with it as opposed to just observe it. I'm going to invite you now to bring all of your attention down to the left hand and onto the belly underneath the left hand. And begin to notice just whatever expression of breathing is present for you in the belly under the left hand. Whatever movement you do feel, however subtle or however significant, you can recognize as a direct expression of the engagement of your diaphragm, of the diaphragm moving down and creating that vacuum to draw air in on the inhale, and of relaxing and moving up and pushing air out on the exhale. So what we would like to invite you to do at this point is to become more intentional with the workings of the diaphragm here, to really connect with that experience of the diaphragm doing its work and being intentional with it. So to do this, I'm going to invite you to imagine that your belly underneath your left hand is like a balloon that's inflating when you're breathing in, and it's softening and falling back inwards or emptying on the exhale. Or if you'd like, you can actually think of your belly or imagine your belly as an extension of your lungs. So your belly is also filling on the inhale and emptying on the exhale. So with the next inhale, intentionally expanding that balloon, pressing the belly out the front as the breath flows in, sensing the hand moving out. And then on the exhale, intentionally drawing the belly back in towards the spine, letting the hand fall back in. Next breath will be a little deeper. letting the breath out really slowly. Really seeing if you can connect with this intentional diaphragmatic breathing, soft belly breathing pattern. Exploring the possibility of getting a deeper breath with the belly, with the diaphragm more engaged. And then taking your hands away, so you remove the biofeedback tool, but continuing to connect with this practice of engaging the diaphragm and the belly, seeing if you can do it without the hand. And then just to close the practice, you can let go of controlling the diaphragm and the breath at all, just allowing your attention to remain on the experience of the breath coming in and out of the body, noticing the echo of this practice of intentional soft belly breath or diaphragmatic breathing. What's present for you now?
Thank you for listening. Have a good day.